We start with this. Pfizer Inc. and BioNTech's COVID-19 vaccine appears to work against a key mutation in the highly transmissible new variants of the coronavirus discovered in the UK and South Africa. That's according to a laboratory study conducted by the US drug maker, but it says that a lot more research needs to be conducted. The variant discovered in South Africa, known as the N501Y mutation, has been detected in a number of countries, including Australia, Austria, China, Cyprus, Finland, Norway, France, and Switzerland. Meanwhile, South Africa has detected 20,999 new coronavirus infections in the past 24 hours, slightly less than yesterday's figure, which was more than 21,000. This brings the cumulative number of cases to 1,170,590. 441 more people have succumbed to COVID-19 related complications, putting the national death toll at 31,809. The Minister of Health, Mkhize, says that at least 40,000 people will be vaccinated over a period of 12 months. He says that the health system is under immense pressure. And speaking of, the private hospital groups have warned that they are facing severe capacity constraints due to resurgence of COVID-19 in the country. South Africa has, for the second day, recorded over 20,000 new infections. Now, to discuss this further, we're now joined via Zoom by Mediclinic's Chief Clinical Officer, Dr. Gerrit de Villiers. Dr. de Villiers, thank you so much for joining us here on SABC News this afternoon.
Thank you, Flo. Good afternoon.
You know, I suppose there might be some sort of misconception or perhaps a false perception that that private hospitals have it a lot easier when it comes to dealing with COVID-19, and that's not really the case, is it? We're finding that you're just as strained as the public hospitals, aren't you?
That is correct. We are severely strained. I cannot really say we are as strained as they are, but our capacity is often limited with the number of COVID cases we can manage because of the design of our facilities and how our normal business. So all of a sudden we are seeing larger volume of cases in our emergency centers and people presenting for treatment in our intensive and high care units. So we are taking severe strain. We are under severe pressure. That is correct.
Have you had situations where you're saying it's not as bad as the public hospitals, yes, but have you been faced with a situation where perhaps you don't have a bed for a patient, where you've perhaps had to find other measures, or do you even have contingency measures in place, in fact, in case there is a situation where you run out of bed? I mean, there's a lot being said about this new variant that is going to be a lot stronger than the previous one, and that will find a lot more people having to go to hospitals. I mean, the public sector has the field hospitals, I suppose, as the contingency measure in place, and I just wonder, in terms of the private hospitals, what do you have as your backup plan?
So, Flo, the one thing that we have as our card is that we have stopped all our elective surgical work. That's a large percentage of our normal bed occupancy, and that have freed up those beds. There are times when a specific hospital does not have a bed, and then we use our intra-hospital transfer channels to transfer that patient between hospitals. So we do that on a very regular basis at the moment. In fact, the call center I spoke to earlier said the calls for handling this have increased dramatically in the first week of January only compared to December already. So the number of patients requiring transfer and requiring assistance has increased dramatically.
And I mean, it must be a relief to your staff and your colleagues that as frontline workers, you'd then be first up to get the vaccine when it eventually does arrive. What is the feeling amongst your peers when it comes to this vaccine, particularly in the private sector?
Yeah, we are very excited that will be available for South Africa. We fully agree with government that we should support our frontline healthcare workers, protect them, because if they are protected, they can protect the public and assist the public. So we are all very excited about this. We are making all plans to make sure that we roll it out as quickly as possible, and that we will also, not only our own staff, but also our supporting doctors are included in our calculations of the number of people needing vaccinations during the first round.
Yeah. What do you believe are the lessons that you would have learned from the first wave? I'm going to call it the first wave just because everyone's calling that, but I know doctors prefer us to say variant. What is the lessons that you've learned in that first wave that will help you better tackle what's to come now? I mean, you might have seen in the public sector, I think one of the issues that were raised by doctors in the public sector was that, for example, Baragwanath had the ICU empty. I don't know if you saw the pictures during the time of New Year's Eve celebrations because of the alcohol ban. So there weren't as many injuries, fatalities and so forth at Baragwanath Hospital. And I suppose those are not the same issues that you're dealing with in the private sector, but surely there are some lessons and some things that you think are worth doing going into really this dangerous situation that we're in.
Yeah, I would like to say that we actually do see a second wave. If we look at the number of cases admitted, there was a definite peak that leveled off, and now we're seeing a second peak. We've certainly learned very valuable lessons from the first wave. I think I'll start with the whole PPE, and you'll remember there has been a lot of communication around personal protective equipment. So we learned our lessons there about what to buy, where to buy, and how to distribute it through our facilities. Yeah. The same, I would think, goes for equipment. We have managed to move equipment around between hospitals that are in different stages of a surge. And, we've purchased more and more equipment to be able to render care to more patients. And the same goes for oxygen. We've ramped up our oxygen storage and oxygen supplies to our hospitals and the way we monitor it. So, those infrastructure, structural type of things we've learned a lot from. And then also with our staff, the emotional support they need, the training they need, the hours they can work, how we can help them cope with the severe load of patients. Those lessons we've all learned in the first wave, we're applying them in the second wave. Definitely has been very worthwhile having the first wave at that time and having time afterwards to learn those lessons and incorporate them in the way we practice in our hospitals.
Yeah, I understand that you're calling back some of your staff. I don't know if it's particularly the hospital that you are at, sir, but I do understand that, staff is being called back from leave and so forth. So that also does point to the fact that you're needing more hands on deck at this time. Are you finding that that's also the situation where you are?
That's correct. We have recalled many staff back from leave, especially nursing staff. All the surge hospitals have basically looked at the staff currently on leave, tried to give them some break at least, and then try to pull them back from leave. To assist, we definitely need all hands on deck. It is definitely one of the tools we have to increase our capacity. Another reason to pull people back from leave is, of course, we have people that are exposed to the virus and need to isolate, or quarantine, or some who are actually infected and need to isolate as well. So we definitely have them then out of circulation for 10 to 14 days, and we need people in their place to assist us.
Yeah. I've obviously, as we report on coronavirus, on COVID-19, we unfortunately are hearing of medical staff succumbing to COVID-19, and I suppose a lot of those numbers are kind of looking or focusing on the public sector. When it comes to the private sector, how bad has it been, or have you kind of managed to kind of what's the word I'm looking for? But have your staff been okay in terms of contracting the virus? I'm sure there have been people contracting the virus, but in terms of fatalities, I wonder what it's looking like in private hospitals. Do you know at this stage?
Yes, we unfortunately had some fatalities as well. Every fatality for us is a massive loss to us as a community of healthcare workers. We've lost a registered nurse in the last week. We have more than one staff member in ICU at the moment. We have some of our affiliated doctors in hospital, some in intensive care as well. We continuously monitor what happens with our staff who are sick and not at work, especially with COVID. Yeah. The numbers I can unfortunately not disclose to you. We're disclosing them to the National Department of Health. They recollect the numbers for all the private facilities. But every case that we lose is a big, big loss to us. I must say, Flo, I'm taking my hat off to the people that has worked through the second wave. The resilience they have, the hours they put in, the compassion they have. It's amazing how people has put in all these hours to save as many lives as possible.
Dr. de Villiers, a great pleasure speaking to you, and thank you for giving us your time here on SABC News, sir.
Thank you, Flo. Thanks.
All right, that's Dr. Gerrit de Villiers, Mediclinic's Chief Clinical Officer, helping us really to see what's happening, a clearer picture of what's happening in private hospitals there for you. I think that the focus has been a lot on the public hospitals, but certainly just some information there with how the private hospitals are doing.